Hi, everyone. Welcome to the Youth Advisory Council interview series. We, the Youth Advisory Council at the Center for Youth Bipolar Disorder, or CYBD, at CAMH, have started this series to try to raise awareness and translate knowledge from the ongoing bipolar disorder research in a way that is accessible and meaningful to patients and families. This is the second interview in the series. CYBD's Youth Advisory Council, also called the YAC, was established in 2021 and is composed of 6 youth advisors with bipolar disorder. The YAC team allows the opportunity to meaningfully engage with our patients and integrate their voices towards education, stigma reduction, and advocacy efforts in the field of youth bipolar disorder. A great accomplishment of the YAC has been the creation of Never Alone, a Youth's Guide to Bipolar Disorder, which is an informative and inspirational booklet that shares firsthand narratives of youth with bipolar disorder, written by youth for youth. This series is an extension of the YAC team's efforts. Today, we have 3 youth advisors interviewing one of the CYBD researchers. My name is Kaylee, and this is my second term on the Youth Advisory Committee. I am also a second-year PhD student at U of T.
My name is Nick, and this is my first term on the Youth Advisory Committee. I'm going into my second year as an undergraduate student in a concurrent education degree.
And my name is Tara, and this is my second term on the Youth Advisory Committee. I'm a medical student heading into my third year.
Today, we have Dr. Kody Kennedy here, who is a scientific associate at CYBD. He's here to talk to us about his research. Thanks for coming, Kody.
Thanks for inviting me.
So Kody, we were hoping you could tell us a little bit about your current role at CYBD, what it entails, and how long you've been here for.
Yeah, so I've been with CYBD since 2018. I'm currently a scientific associate. My role entails running research visits with participants, mentoring incoming and current PhD students, analyzing imaging data such as brain and heart imaging, and also writing grants that fund our research and writing papers based on the grants. As for my background, I earned my undergraduate degree in life sciences, specializing in pharmacology and toxicology from the University of Toronto. Initially, wanted to be a doctor. However, I shifted my career path in my third year due to how competitive medical school was and explored other opportunities. I decided to try a co-op placement in the pharmaceutical industry, doing quality control during my fourth year. However, unfortunately found that I didn't really enjoy doing that. So when I returned for my fifth year of studies, I engaged in drug discovery research in the chemistry lab, which also didn't appeal to me as a career. I then decided to pursue a master's degree in clinical research at the Center for Youth Bipolar Disorder and quickly realized my passion for this research, leading me to transfer to a PhD program. And then upon completing my PhD, I decided to continue my career in clinical research at the Center for Youth Bipolar Disorder.
Very cool. Thank you so much for that summary of your background. Now let's get into the meat of the interview. What is your current body of work focused on, and how did you decide to pursue this specific topic of research?
Yeah, so my research is focused on understanding the heart-brain connection in bipolar disorder by using heart and brain imaging data acquired from an MRI. I decided to pursue this topic of research as I wanted to do clinical research. I knew based on courses I took in undergrad, I was interested in both mental health and cardiovascular disease. So based on being able to study both, how both of these topics are related to each other seemed like a great opportunity to me.
That's awesome. Thank you. We would love to hear a bit more about your research, and we were hoping that you would be able to break it down for us. There were a few of your papers that we were interested in. I'll just list them here. So the first one is called "The Association of Blood Pressure with Brain Structure in Youth with and Without Bipolar Disorder." The second is "The Differential Association of Endothelial Function with Brain Structure in Youth with versus Without Bipolar Disorder." And the third being "Elevated lipids are associated with reduced regional brain structure in youth with bipolar disorder." So we would love if you'd be able to give us a brief synopsis of these papers and how they're related, and maybe just how you would explain it to a middle school student.
Yeah, of course. So I'm going to summarize how these three papers that all broadly study how heart health and brain health are connected. So my research focused on these papers focused on how things like blood pressure, cholesterol levels, and how the blood vessels function in the body, which all relate to heart health, can affect brain structure and brain health in youth, both with and without bipolar disorder. In brief, I found that poorer heart health is linked to smaller brain size in youth, which is believed to be bad. I also discovered that these effects are stronger in youth with bipolar disorder compared to those without bipolar disorder.
That's very cool. Thank you. I like how it has a cohesive theme. Could you talk a little bit about more the brain structure in bipolar disorder, and why did your research focus on brain structure specifically?
Yeah, so bipolar disorder is a mental health condition that causes mood swings, which entails making people feel either very happy at some times or very sad at other times. And studies have shown that youth with bipolar disorder have differences in brain structure in regions that regulate mood. And understanding these changes can help explain why people with bipolar disorder have these mood swings and lead to new treatment options.
Thank you, Kody. So you mentioned cardiovascular risk and its effects on youth with bipolar. I was hoping you could expand on what cardiovascular risk is and why it's relevant to brain structure in bipolar disorder.
Yeah, so broadly speaking, cardiovascular risk just describes what is the potential future occurrence or risk that someone might have for heart disease. We know that people with bipolar disorder develop cardiovascular disease earlier and more often than healthy controls. And this matters for brain structure because the cardiovascular system and the brain are closely connected. The healthy heart and the cardiovascular system delivers oxygen and nutrients to the brain, which helps it function properly. If someone has heart or blood vessel problems due to factors such as high blood pressure or cholesterol, it can reduce the blood flow to the brain, and this can cause changes in how the brain is functioning and also its structure, making it harder to regulate mood. Taking care of both the heart and mental health is important to feeling better overall, which is why I was interested on cardiovascular risk in relation to brain structure.
Thank you so much for explaining it in that way. I don't think that's an association that a lot of people know about, and it's really interesting. So we appreciate your insight on that. We were really just wondering, what advice would you give to youth based on the findings so far from your research?
Yeah, so I personally advise that any youth, whether they have bipolar disorder or not, to consider maintaining good cardiovascular health. As research has shown that youth with bipolars or youth that exercise and eat healthy not only feel happier, but they also do better in school and are less stressed. Additionally, maintaining good cardiovascular health will also prevent future heart disease and has the dual advantage of benefiting both brain health and function, which may also help with regulating mood.
That's great that you mentioned that, especially in everybody's days, busy days. Some people might need extra reasons to get out there and exercise. How do you think this research is practically relevant for patients either now or in the future? You alluded to it a little bit, but could you explain in detail how can these findings be applied to their lives?
Yeah, so right now, brain structure itself isn't necessarily applicable to an individual, but going back to my previous answer, I think the practical relevance for right now and in the foreseeable future for participants is just considering maintaining optimal cardiovascular health. I think this starts with lifestyle interventions such as exercising, eating a balanced and healthy diet, reducing smoking, and for people also to consider getting regular health checkups so that they know if they have high blood pressure or other cardiovascular risk conditions. They can seek treatment for that, and that would help with preventing any of these negative associations that may affect people's brain, which may be more relevant to youth with bipolar disorder.
Thank you. So, did any new questions arise as a result of this research, or is there anything specifically that you plan on looking into further in the future?
Yes, my research has raised several questions. The main question it brings up is related to how heart health affects brain health in young people, especially those with bipolar disorder. In the future, I aim to explore research that focuses on improving heart health in youth. Similar to my prior answer, this could involve initially lifestyle changes like exercise. We actually have a current study at the Center for Youth Bipolar Disorder looking at how exercise affects mood, and then also potentially using medications that are known to improve heart health for use for people with bipolar disorder, and investigating whether that improves mental health as well.
That's really exciting. Thank you so much. Why is it important to have youth with lived experience involved in the research process?
So I think involving youth with lived experience in research is essential for several reasons. Firstly, the firsthand perspectives offer unique insights that can shape research questions, methodologies, and ensure that studies are more relevant and meaningful to the patient population. Secondly, the participation enhances the design of studies, making them more sensitive to the needs and experiences of youth. Thirdly, involving youth empowers them by giving them a voice in the decisions affecting their health or circumstances and fosters a sense of advocacy. And lastly, I think involving youth in research activities, like this Youth Advisory Council, helps ensure that the research is translated from the academic audience into the community in an effective and understandable format so that this knowledge benefits the end users essentially.
Thank you so much for that, Cody. We totally agree, and that's definitely the purpose of the series and what we're trying to accomplish here. We know how important it is to empower youth, especially that firsthand being on the Youth Advisory Council. So, yeah, we totally agree. That's awesome. We were just wondering now, in next steps for your research, what are you the most excited and hopeful about, and why?
Yeah, so considering my research is aimed towards generating the early like stages and relationships between heart and brain health, I'm excited to see where this research leads in the future and determining and seeing how policies may change in the future that aim towards integrating heart health alongside brain health, which may yield new therapies and treatment options for use with bipolar disorder.
That's great. So, it's been very interesting to hear your answers to our questions. But we're curious if you have anything specifically that you'd like to share about your research or your journey.
Yeah, so about my journey, I think the major advice I have for everyone is that not everyone has a linear career path. I think everyone has a tendency to try and plan out their future, which is good. but I wouldn't get discouraged if you don't get into a certain program or school or aren't enjoying your current studies or current job. You can always change the direction and follow your passions. It personally took me several attempts to find something I enjoyed. I'm ultimately happy with where I ended up.
Thank you so much for breaking down your research for us and for sharing your insight and your journey. We learned a lot about how heart health and brain health are connected. We learned about the importance of maintaining good cardiovascular health and also why it's important for youth with bipolar disorder to be involved in the research process. We know our audience will appreciate all your insights, and thank you so much. That's all the time we have. A reminder to our audience to stay tuned for our next interview in the series. Thank you, everybody.